Epidemiology introduction. Then cardiac causes. Cardiac arrest, it may be cardiac causes. Cardiac causes heart disease. Approximately 60 to 70% of the sudden cardiac arrest is related to coronary heart disease. Among adults, ischemic heart disease is the pre, predominant cause of the cardiac arrest. Okay, it is one of the cardiac arrest is one of the cause is coronary artery disease and non-ischemic heart disease, that may be cardiomyopathy or a cardiac rhythm disturbances, ventricular tachycardia, ventricular fibrillation, asystole, and a pulseless also, and a hypertensive heart disease and a congestive cardiac heart failure. These are the all non-ischemic heart disease, and above is the cardiac coronary heart disease. Okay. Then next comes to non-cardiac causes. Sudden cardiac arrest is unrelated to heart problems in 30% of the cases, and it may be traumatic injury, any severe traumatic injury, or a non-traumatic related bleeding, such as a gastrointestinal bleeding or a aortic rupture and a intracranial hemorrhage. These are also non-cardiac causes, and medications like overdose of the calcium channel blockers, digitalis, or a beta blockers. And next comes to drowning. Drowning is also one of the non-cardiac cause. It may also lead to sudden cardiac arrest, and a pulmonary embolism is also one of the cause. Then H and T's. Okay, H and T's is the name of the mnemonic used to aid is in remembering the possible, treatable, or the reversible causes of the cardiac arrest. Okay, H, so many H. That is hypovolemia, hypoxia, hydrogenions, or a tension pneumothorax, hyperkalemia, hypothermia, and a hypoglycemia, and hyperglycemia. These are the H related H. The mnemonic H, first starting letter is a H. That is a hypovolemia, hypoxia, hydrogenions, and a tension pneumothorax. Then next hyperkalemia, hypokalemia, hypothermia, hypoglycemia, and a hyperglycemia. Then T's, tablets or a toxins, cardiac tamponade, and a thrombosis, and thromboembolism, and a severe traumatic injury. These are all related to S. Starting is letter is a S. Then risk factors. Okay, what are the risk factors? Cardiac arrest, that is sex. First is sex. The lifetime risk is the 3 times greater in men, that is 12.3%. Then the women 4.2%. Smoking is one of the cause cardiac arrest. Okay, smoking. Then lack of physical exercise. If the patient is having any sedentary work or only official work in a setting, and these people are more prone to cardiac arrest. Lack of physical exercise. Obesity is also one of the cause. Diabetes mellitus also one of the cause, and a family history. It is also risk factor for the cardiac arrest. Then classification of the cardiac arrest. এটা ଗୋଟେ ସାଇଡ୍ ଗୁଡ଼ାକ ଟୋଟାଲ ମାନେ ଗୋଟେ 40 ଟାଇମ୍ 50 ହେଇଯିବ। ଏଇଟା କଲା ପରେ ଆଉ ଗୋଟେ ଷ୍ଟାର୍ଟ କରିକି ଏଇଟା କଲା ବେଳକୁ ସରିଯିବ। ଏଇଟା ସ୍ଲାଇଡ୍ ସରିଯିବ, ଆଉ ଗୋଟେ ସ୍ଲାଇଡ୍ ଅଛି ସେଟା କ୍ଲିକ୍ କରିକି ଷ୍ଟାର୍ଟ କରିଦେବେ। କିଛି କାମ ନାହିଁ। Then classification based upon the ECG rhythm. Okay, All are audible? Slides are visible? Hello.
Yes, yes, ma'am.
Huh. It is audible?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Okay. Thank you. Based upon the ECG rhythm. Okay, uh, classification of the cardiac arrest, that is based upon the ECG rhythm, shockable and non-shockable. Okay, so shock through shockable. The two shockable rhythms are ventricular fibrillation and another is a pulseless ventricular tachycardia. That is shockable. Then non-shockable, that is the two non-shockable rhythms are asystole and a pulseless electrical activity. This refers to whether a particular class of cardiac rhythm dysarrhythmia is treatable using a defibrillation. The next pathophysiology of cardiac arrest, mainly these factors. Any one risk factor, it may be diabetes or it may be smoking or it may be severe traumatic injury or it may be coronary arterial fibrillation or ventricular fibrillation. These are all any one cause that leads to conducting abnormality in the heart. Then if the conducting abnormality heart, then automatically inability of the heart to contract properly, then that leads to decrease the cardiac output and that leads to decrease the tissue perfusion and it automatically compress the function of the heart, then that leads to sign and symptoms of the cardiac arrest. Then next sign symptoms of the cardiac arrest, mainly the most reliable sign is absence of the pulse. Patient became suddenly unconscious. Apnea, the absence of the pulse. Then low blood pressure. Automatically low blood pressure, pulse are not finding. Then pupils begins dilating within 45 seconds. Seizures may or may not be occur and death like appearance, lips and nails burst turn blue. Okay, these are the cyanosis symbol and these clinical features are seen in the cardiac arrest. Then diagnostic evaluation. Mainly first we will take the history collection and a physical examination of the clients and electrocardiogram if possible, electrocardiogram. Then cardiac catheterization, echo, cardiograph, Holter monitoring and exercise or a stress test, MRI study and a blood study, which include the examination of the cardiac enzymes level, serum electrolyte level and hormonal levels. These are the blood tests we will done by specially cardiac arrest patients. Then these are the electrocardiogram ECG. ECG, the ventricular fibrillation, like this type of picture we will see. Then pulseless electrical activity, that is PEA, pulseless electrical activity. Okay, the picture like that. And asystole, only one straight line is drawn in the graphical paper. Then ventricular tachycardia is like that. Okay, the picture is shown, the ventricular tachycardia VT. Okay, identify the different types of ventricular fibrillation and pulseless electrical activity PEA and asystole and a ventricular tachycardia VT. Okay. Then next comes to management. Then management mainly the first is a patient stimulate and the assess the response. If the patient is not responding, open the airway and check breathing and check the breathing. Then after 5 rescues breathe. Okay. Then check the pulse. Pulse, if the patient pulse for the signs of the circulation. Pulse, checking the pulse, that is the check for the signs of the circulation. And then after we will give the CPR. CPR chest 15 chest compression to ventilation. Okay, somewhere it is also 30 compression and 2 mouth to mouth ventilation. It is also given in some flowchart, and always we will follow the American Heart Association flow chart. Okay. Then next comes to shockable and a non-shockable. Assess the rhythm. Rhythm, we will assess the rhythm. Then ventricular fibrillation or a ventricular tachycardia. Now, if we will prepare for the patient in a shockable, then it is automatically ventricular fibrillation or a ventricular tachycardia. Then DC shock, direct current, that is 4 joule per kg, and 2 minutes CPR, check the monitor. Then intubate the high flow oxygen IV, then DC. Then this is shockable. Then next 2 minutes, these are the medical procedure. We in the presence of the doctor only it is possible, and the doctors are given the shockable treatment. Okay, these are all regarding the DC shockable defibrillator. We will use the defibrillator. Then after 2 minutes CPR, then administered then DC shockable. Then after 2 minutes shockable, the DC shockable given to the patient. Then next comes to non-shockable. Asystole and a pulseless electrical activity. Then leads to ventilate with high flow concentration of the oxygen. Then continue CPR and intubate the patient IV or a inotropic assessor drugs. Then adrenaline given to the patient 10 mcg per kg IV or inotropics. Then 4 minutes CPR. Then after check the monitoring. Okay, these are all the two types of shockable and non-shockable cases. Then after we will see the patient's condition. Then comes to CPR. CPR cardiopulmonary resuscitation. Okay, CPR cardiopulmonary resuscitation is an emergency procedure for the people in a cardiac arrest or in some of the circumstances respiratory arrest. CPR is performed both in hospital and pre-hospital settings. Hospital as well as a pre-hospital setting. Cardiopulmonary resuscitation is the process of externally supporting circulation and respiration of a person who has a cardiac arrest. Then resuscitation measures are divided into two types. One is a basic life support and another is a advanced life support. Basic life support and advanced life support. The CPR steps like that, early assess the patient and to get the help. Then second one is a early CPR given the compression. Then after early defibrillation, then advanced life support. Any emergency call, if the call is received, then patient shifted to the hospital and early advanced artificial life support. Okay, defibrillator advanced life support we will use. Then aim of the CPR. The aim of the CPR is to maintain victims' breathing and circulation until the emergency aids arrive. Purpose of the CPR that mainly to maintain an open-handed door airway, that is A. Then to maintain the breathing by external ventilator B. To maintain the blood circulation by the external cardiac message C. To save the life of the patient by restoring circulation, cardiopulmonary functioning, and prevent the irreversible brain damage from the anorexia. Okay, to provide basic life support till the medical and advanced life support arrives. Then next indication of the cardiac arrest. What are the indications? If the patient is cardiac arrest, then a ventricular fibrillation, ventricular tachycardia, asystole, or a pulseless electrical activity. Okay, less pulseless electrical activity. Then respiratory arrest. This may be leads to due to following condition: drowning, stroke, then foreign body in the throat, any foreign body locking in the throat, or a overdose of the any toxin drugs, or a suffocation in the during the drowning, suffocation, and accident, severe accident, patient having coma stage, any type of coma, it may be diabetic coma or any type of coma stage, and a epiglottis paralysis. These are the respiratory conditions for indication of the cardiac arrest. Then comes to life support. Okay, adult basic life support algorithm for the healthcare provider, that is verify the scene safety first thing, then check for the response of the patients or a client, and shut down for the nearby help, and activate the emergency, any type of emergency response system via the mobile phone, or if appropriate, then get the AED. AED means AED and emergency department, we are information given to the through mobile. Then comes to look for look for no breathing, or only gasping, and checking the pulseless stimulus, any type of stimulants is pulseless, definitely felt within the 10 seconds. Then after we provide the compression. Okay, chest compression given to the patient, start the perform the cycles of the 30 compression and 2 breaths. Then the monitoring until the emergency response not come, any device response arrives, then normal breathing, pulseless pulse feel, and no normal breathe. If the no normal breathe come, then after we will start the CPR. Okay, then CPR started, and check for the rhythm, shockable or a non-shockable. If patient is responding in the 30 cycles, then after mouth to mouth breathe 2 times, use a ventilate, advanced life support we will use. Okay, if it is not responding, then provide the rescue breaths, one breath every 6 seconds, or the 10 breaths a minute. Check pulse every 2 minutes. If no get pulse, then start CPR. जो CPR process start हो जाएगा, then after possible opioid and administered the narcotics available to the patients. Okay, these are all the flow chart regarding the CPR. Then CPR procedure. Part 1, taking vitals. Part 2, administered CPR. Checking the scene for the immediately danger. Then assess the victim's consciousness, call for the help, and check for the pulse. Carotid pulse, adult, and a femoral pulse in the children. For case of children, femoral pulse we assess. If the patient have adult, then check the carotid pulse. Then next comes to second part is the administered CPR. Place the victim on his or her back, then place the heel of the one hand on the victim's breastbone, and place your second hand on the top of the first hand. palms down and interlock the fingers of the second hand and between the first. Then positioning bodily directly over your hands and perform the chest compression. Then chest compression rate 100 per minute. That is depth 4 to 5 cm. That is 1.5 to 2 inches. And give 2 rescue breaths. Pinch the nose and take a normal breath. Place your lips over a mouth and blow until the chest rises. Take about 1 second for the one breath. Allow the chest to fall. Repeat. Then part 3, using an automated external defibrillator. Defibrillator used to restore the patient's heart rate rhythm by using the therapeutic electrical shock. Defibrillator used mostly in terms of terminate pulseless case. Pulseless case, that is ventricular tachycardia, ventricular fibrillation, then defibrillator emergency charge, biceps and monoceps. Biceps are 120 to 200 joules and monoceps 360 joules. Then place of the pedal, base of the heart and apex of the heart. Pedal pressure in defibrillator 25 lb. Okay, these are the procedures. BLS total chart will be given जो BLS का. Then BLS for the healthcare professionals, BLS CPR कार्डियक अरेस्ट पेशेंट को लिए हमारा CPR जैसे फ्लो चार्ट है. देन अडल्ट केस के लिए, चिल्ड्रन केस के लिए कैसे दे रहा है, ऑल टोटल हम लोग अभी जो कुछ भी पढ़ा है वही का एक फ्लो चार्ट है, प्रोटोकॉल. ऐसे उसको हम लोग फॉलो करेंगे. ओके, दिस इज ऑल अबाउट द टोटल description of the flow chart. Then next comes to complications. It may be due to high pressure of the ribs or sternum. The ribs fracture occurs. Then sometimes a flare chest also occurs, and a long injury or a long contusion also occurs, and abdominal organ or injury or a life most prone to injury, and a vomiting, aspiration vomiting, then pneumothorax and a hemothorax and a sternal fracture. These are the completion of the CPR. Then drugs used in the cardiac arrest, epinephrine, that is epinephrine more commonly known as adrenaline, is a hormone secreted by the medulla of the adrenal glands. Then indication cardiac arrest, or ventricular tachycardia or a ventricular fibrillation, asystole, pulseless electrical activity, symptomatic bradycardia after the atropine. Okay, after the atropine, dose 0.1 mg per ml in 10 ml syringe, that is 1:10,000 solution, that is dissolved, and adult 1 mg IV every 3 to 5 minutes. Then children 0.01 to 0.03 mg per kg. If the quotation is the each 1 mg bolus IV dose and should be flushed of 20 ml fluid, hotness in site of the SOB, shortness of breath, irregular pulse. These are the we have seen these things. Then amiodarone blocks the K effluxes class 3 anti-dysarrhythmic, also has a sodium channel blocker class 1 and a beta blocker class 2 and a calcium channel blocking class 4 and a properties also, and a dose pulseless ventricular tachycardia, ventricular fibrillation 300 mg IV rapid push followed by 150 mg IV rapidly push if necessary. Next pulse check. Then stable wide complex tachycardia 150 mg IV over 10 minutes followed by the infusion of the 1 mg per minute, and that is 6 hourly. Then the 0.5 mg per minute thereafter. Then child, that is 5 mg per kg, maximum 300 mg. Indications: pulseless ventricular fibrillation, ventricular tachycardia, then wide complex tachydysarrhythmia. These are the, then we will see that causes of hypotension or then pro-dysarrhythmia, and these are the different PEG-D. These are the symptoms we will consciously we deal. Then adenosine. Adenosine is the primary drug used in the treatment of the stable narrow complex, okay, supraventricular tachycardia cases. Supraventricular tachycardia. Then dosing. The first dose of the adenosine should be given 6 mg administered rapidly over 1 to 3 seconds, followed by a 20 ml NS bolus. If the patient's rhythm does not convert out of the supraventricular tachycardia, then within 1 to 2 minutes, a second or a 12 mg dose may be given in a similar fashion. Then in case of children, 100 mg per kg. First dose, first dose. Then second 200 mg per kg. The mainly we will see in that the case do not given in the pre-existing second and third degree block. Okay. Then after dopamine, all you know that dopamine alpha 1, alpha beta 1, and the dopaminergic agonist. Dose is less than 5 mcg per kg per minute. IV dopamine effect no recommended, or a 5 to 10 mcg per kg per minute. IV primarily beta effects. Then positive inotropic or a vasodilation. Then 10 to 20 mcg per kg per minute. IV primarily alpha effects, vasoconstriction. Indication: decompensate heart failure, hypotension. Then mainly we will see that the case tachydysarrhythmia, tissue necrosis, if extravasation or the arterial administration of the therefore needs to be given through central venous line. Then dobutamine mainly synthetic catecholamine, beta 1 agonist less than beta 2 agonist. Then dose 2 to 20 mcg per kg per minute IV. Then indication: decompensate heart failure, refractory hypotension, and that mainly we will see that tachycardia, hypotension, if not euvolemic, equally volemic PVC, and a PEG-B. Then nursing management. In case of the cardiac arrest case, so nursing management mainly depends upon the nursing diagnosis. Decreased cardiac output related to cardiac arrest or a dysarrhythmia, that may be that goal: maintain the cardiac output. Then nursing intervention: assess the vital signs, CBP, urinary output, and a peripheral pulses. Then assess the heart rate and a rhythm, ECG. Then oxygen administration as hypoxia and can lead to further dysarrhythmia, and administer drugs, anti-dysarrhythmic medications as ordered. Then administered fluid electrolyte fluid therapy as ordered. Then nursing and diagnosis too, that is risk for the ineffective respiratory pattern that related to condition, maintain the respiratory pattern. Then nursing intervention mainly assess the respiratory rate, auscultate the breath sound and provide the Fowler's position. Monitor the pulse oximetry and ABG analysis, report any abnormality and a continuous monitoring for the first half hour of the defibrillation. Then nursing diagnosis to impairment of the tissue, impaired tissue perfusion related to decreased cardiac output. Then maintain the tissue perfusion. Then our intervention is like that. Note the color and the temperature of the skin and monitor the peripheral pulse and monitor the urinary output and provide the warm environment. Then next comes to risk for the fluid electrolyte imbalance related to physiological changes. Then our goal is to balance fluid and electrolyte level, and our nursing intervention is like that, monitoring the intake and output chart and maintain the fluid and diuretics and monitor the electrolyte daily and replace as ordered and monitor the BUN, blood urea nitrogen creatinine and urine electrolyte daily. Then next diagnosis is nursing, then risk for the complications related to disease process. Then procedure performed hand defibrillation. Goal is prevent complication. Nursing intervention like that. The assess the level of the consciousness, reorient the patient place and a person, and assess the vital signs and a ECG continuously, and initiate IV antidyarrhythmic therapy as prescribed, administered IV fluids to correct the fluid electrolyte imbalance. This is all about the cardiac arrest. Next, we will see the other topic. नमस्कार. Hello student. Hello student.
Yes, ma'am.
Next topic is sepsis. All you know regarding sepsis. What is sepsis? Due to sepsis,
मैडम ये एक लाइफ थ्रेटनिंग ऐसी कंडीशन है जो सीवियर कंडीशन है इन्फेक्शन की, जिसमें बॉडी अपना नॉर्मल फंक्शन नहीं करती, जिसमें मल्टी ऑर्गन डिसफंक्शन हो जाता है.
Okay, very good idea. Sepsis is the number of the causes. Okay, sepsis is a serious condition. All you know that in the clinical, the ICU also, so many patients having a sepsis or a septicemia. They are multi-organ failure. They are admitted in the hospitals. So sepsis is a number of the causes of death in the hospital, causes for the readmission. Okay, readmission. If the patient is having operative, it has been an operation, then the stitches are not closed. Okay, the stitches are not properly healed. Then after sepsis occur. Okay, readmission also, sometimes a patient having a readmission due to sepsis. And a healthcare cost. It is also increases the healthcare cost. Then up to 50% of the sepsis survivors suffer from the long-term physical and psychological effect. 40% of the cases are children under 5 years. 47 to 50 million cases per year due to sepsis. At least 11 million deaths per year. Okay, in one in 5 deaths worldwide is associated with sepsis. This is regarding the all data regarding the sepsis and sepsis statistics also. Okay, the incidence prevalence. This is how people are attacked and how million people are died due to sepsis. If we will find out the sepsis in 80 times, then only we find early treatment and prompt action, the sepsis will be reduced and automatically it will be treatable. Okay. Then comes to sepsis. Sepsis is a life-threatening organ dysfunction caused by a dysregulated host response to an infection. Okay, sepsis is a life-threatening organ dysfunction caused by a dysregulated host response to an infection. Then comes to sepsis, severe sepsis, then septic shock. Okay, 3 things occur. First appears the sepsis, NA sepsis. If the sepsis is not treatable within time period, then after it may be severe form and it termed as a severe sepsis. Then after it may be septic shock. Then causes of the sepsis. Okay, causes, it may be lung infection or it may be skin infection or any type of gut infection, then urinary tract infection, UTI, all you know that. Then E. coli is the causative organism, E. coli, Staphylococci, Streptococci, most of the common bacterial condition. Then next goes to septic shock. Risk factor for the septic shock: suppressed immune system. Okay, suppressed immune system. Then extreme age. It may be infant or it may be elderly people, geriatric people. Those who are immune compromised stage and also they have a less immunity. Okay, and procured organs. Transplantation. If the patient having any type of transplantation, if the patient having the organ transplantation like eye or a kidney or any other things transplant, then also it occurs the it is the one of the risk factor for the septic shock. Then surgical procedure, indwelling catheter device, indwelling device, any type of indwelling device, invasive procedure. Okay, indwelling device. Then sickness. It is if the patient have so many comorbid condition, then it is automatically occur the risk factor for the septic shock. Then pathophysiology of sepsis. Pathogens invades bloodstream. Then body immune system response is triggered and a WBC cell come to rescue. Then release the inflammatory mediators and the cytokines. Okay, release the inflammatory mediators and cytokines. Then after vasodilation occur and capillary leakage, blood clotting. Then automatically it leads to hypotension and that leads to less blood going to the body organs. Then hypoxia in the organs and anaerobic respiration takes place and a lactic acidosis and automatically it leads to multiple organ dysfunction, MODS. Multiple organ dysfunction occurs. These are all regarding the organ dysfunction or a sepsis pathophysiology. Then comes to signs of the sepsis. Okay, first sign is a fever. severing of the very cold. Then next comes to rapid breathing. Then extreme pain, physical discomfort. Patient feel the extreme pain and physical discomfort. Then after pale or mottled skin, and then disoriented, confusion, and sleep difficulty to walk. Difficulty to walk. Okay, sleepy, patient having a sleepy, confused, and a difficulty to wake. Then next is elevated heart rate. These are all sign of the sepsis. Then sepsis diagnosis. Mainly diagnosis, that is lactic acid. We will find out the lactic acid, PaO2, partial oxygen. We are find out the alveolar oxygen, partial oxygen pressure, then serum glucose, then white blood cell count, then bilirubin test. These are the different tests, creatinine test. These are the tests we will done. Then after we know the sepsis of the patient. Then next, platelet function. Platelet function and a prolactin function. Then PCR test. These are carefully we are done. These are the different types of investigation. PCR test also carried out. Then systemic inflammatory response syndrome, SIRS. SIRS, systemic inflammatory response syndrome. That is more than 2 or more than the following criteria. That is temperature more than equal to 101 degree Fahrenheit or less than equal to 96.8 degree Fahrenheit. Then pulse more than equal to 90 beat per minute, and respiratory rate more than equal to 20 beat per minute, and a partial carbon dioxide that is less than 32 mmHg. WBC count more than 12,000 cells per mm3 cube. Then next is or less than 4,000 cells per mm cube. Then or less than 10% immature band forms. These are all regarding the SIRS, systemic inflammatory response syndrome. Okay, then next comes to sepsis clinical criteria. Infection. Okay, infection, change in the sepsis related to organ failure assessment. Okay, change in the sepsis related organ failure assessment. Assessment more than 2. That is PA, partial oxygen, or a high flow oxygen. That is mainly we assess the ARDS. If the patient having ARDS or Glasgow coma scale. Okay, it is also assess the severe condition of the Glasgow coma scale, bilirubin test, then hypotension or a vasopressors, then platelets count, then decrease the platelet count, increase the creatinine and oliguria. These are all decrease the partial oxygen or decrease the GCS scale. Okay, GCS score is decreased, then hypotension or the vasopressor, then increase the bilirubin, then decrease the platelets and increase the creatinine, oliguria. These are all the clinical features or criteria for the sepsis patients. Then after SOPA, question for SOPA, that is one of the numeric. Then hypotension, altered mental status, tachycardia. Hypotension that less than 100 mmHg systolic, if the patient having systolic 100 mmHg, or altered mental status, if the patient having altered mental status, confusion, then tachycardia, RL more than 22 per minute. Okay, these are the all score of the less than 2 criteria suggest of the greater risk of a poor outcome. Okay, then next comes to management of the sepsis. Management of the sepsis, hemodynamics. Okay, hemodynamic stabilization, then infection, mainly infection detection and a control. Management of the sepsis, hemodynamic stabilization and infection prevention, infection detection and a control. Then hemodynamics, mainly blood, lactate, IV fluid and a vasoactive agents. Then comes to infection detection and control, mainly antibiotics and a source of control. Then time 0 is a time of identification. Protocol should be initiated as soon as the hypoperfusion is recommended. Then comes to our one bundle. Okay, bundle of care, that is in the ICU. All patients having a bundle of care, that is initially resuscitation for the sepsis and a septic shock bundle. Our one bundle, surviving sepsis camping, that is first thing, measure the lactate level. Okay, first is measure the lactate level, and then measure the lactate, if initial lactate elevate more than 2 micromole per liter. Then second one is obtain the blood culture. Okay, obtain the blood culture before administering the antibiotics. Then after comes to administer the broad spectrum antibiotics. Then after begin the rapid administration of the 30 ml per kg crystalloid for a hypotension or the lactate more than equal to 4 micromole per liter. Then after apply the vasopressors if the hypotension during or the after fluid resuscitation to maintain a mean arterial pressure or more than equal to 65 mmHg. Then total, this is about the bundle, our one bundle. Then measuring the lactate level. Hyperlactemia due to anaerobic metabolism and tissue hypoperfusion. Normal value 0.5 to 1 micromole per liter. During septic shock more than 4 ml micromole per liter. If more than 2 micromole per liter, then it should be remeasured with 2 to 4 hours. Then blood culture. Okay, then second one is a blood culture. Microbiological culture includes the blood before starting antimicrobial therapy and should not delay the starting of antimicrobies, that is sites, blood or a CSF, cerebrospinal fluid, urine or a wound or a respiratory secretions, any abscess. These are the sites we collect the culture. Then next comes to numbers, anaerobic, aerobic. Then timing within 5 minutes. Then 2 sets of the bottle culture like a picture given to the and aerobic and in the collection of the blood, that is the procedure. Then third one is the administration of the broad spectrum antibiotics. Every hour delay of the starting broad spectrum antibiotics increasing mortality. Then should be started within 1 hour of the presentation of sepsis. Then antibiotic coverage for gram positive, gram negative, anaerobic and antifungal if indicated. Then fluid resuscitation. Okay, last one is a fluid resuscitation with hypotension and elevated lactate level more than equal to 4 micromole per liter. Initial fluid challenges of the crystal are 30 ml per kg. Normal saline Dinger's lactate will be given to the patient. Then administer the vasopressors. Okay, administer the vasopressor, norepinephrine, vasopressor, dobutamine, then neosynephrine, then epinephrine. These are the drugs we are administered vasopressors. Urgent restoration of the adequate perfusion pressure to vital organs is a key part of the resuscitation. And then after to advise achieve mean arterial pressure then more than equal to 65 mmHg and recommended vasopressor of the choice in the septic shock is noradrenaline. Then source control. IV. What are the different source? We find out the sepsis source. Okay, IV and urinary catheter and endotracheal tubes should be removed if possible, or the changed. The duration of the changing, if possible, then it will be changed. Then access must be drained and a necrotic and a devitalized tissues, that is gangrenous tissues and a gangrenous gallbladder, necrotizing soft tissue infection must be surgically excised. Surgically remove the dead tissue if possible. Then if the source is not controlled, the patient condition will be continue to deteriorate and despite the antibiotic therapy. Okay. Then after supportive therapy. Supportive therapy mainly steroids. If the fluid resuscitation and a vasopressor failed, then if hydrocortisone at the rate 200 mg per day and tapered when vasopressors are no longer required. Fixed duration, tapering and abrupt cessation. Then only should not be used to prevent the septic shock. Then glycemic control. Glycemic control mainly maintain the blood sugar level below 180 mg per dl. If the blood glucose level more than equal to 180 mg per dl, then IV insulin infusion given to the clients. Then avoid hypoglycemia. Then monitoring 1 to 2 hourly. Okay. Then blood transfusion. If hemoglobin level less than 7 gram per dl, then if possible blood transfusion also given to the patient. Then thromboembolism prophylaxis like heparin and sodium bicarbonate therapy given and renal replacement therapy given, stress ulcer prevention prophylaxis given, oxygenation and ventilation support. These are the all total the treatment of the sepsis. Then ICU care bundle. Then next topic is ICU care bundle. All you know in the first chapter, ICU care bundle. Okay, ICU. What are the ICU care bundle? Like BHAP, Class-3, CUTI, and SSI. Okay. Then BHAP, ventilator associated infection bundle of care. Ventilator associated bundle of care, that is known as a VAP. In ICU, all the patients having a ventilator, how we are assessed and how to provide the care systematically through bundles of care. Okay, VAP. VAP bundle of care. VAP is a bundle. Bundle is a set of the intervention taken to prevent to ventilator associated pneumonia, which is an important healthcare associated infection. VAP bundle includes the following interventions. Then elevation of the head of the bed to between 30 to 45 degree. Okay, that is turn the patient to side of the back. Then next, daily oral care. Okay, first is elevate of the bed head of the bed to between the 30 to 45 degree, that turn the patient to side to the back to the side every 2 hourly. Then daily oral care with the chlorohexidine. Okay, chlorohexidine is a solution which is prevent the microorganism growth. So we daily take the oral care through chlorohexidine. Then next comes to daily sedation. Daily sedation, that is vacations reduced to a level that allow the patient to awake once in 24 hours. Okay, daily sedation, vacations that reduce the level of the allows the patient to awake once in a 24 hours. Then next comes to deep venous thrombosis prophylaxis within 24 hours of the start and a mechanical ventilation. Then next peptic ulcer disease prophylaxis within 24 hours to start mechanical ventilation. Then daily assessment of the readiness to be extubated. Okay, these are the VAP bundle, the VAP bundle taken care. Then next comes to Class-C. Okay, Class-C, that is central line associated bloodstream infection bundle. CLABSI, central line associated bloodstream bundles, infection bundles. These are the Class-C. Okay, Class-C. Then Class-C, likewise, first is hand hygiene. Second one is a maximal barrier precaution, that is PPE, head, mask, cap, and shoe, gloves. All those things we are wear maximal barrier precaution. We will take, then after we done the Class-C. Then comes to third one is a chlorohexidine skin antisepsis. Okay, properly chlorohexidine antisepsis we are apply the neck region. Then after we done the central line insertion of the catheter. Then next comes to central line applied. Then next comes to fourth one, optimal catheter site selection. Okay, which side is very appropriate for the patient? Optimal catheter site selection. Then last one is a daily review of the line necessity. Okay, daily review the line. These are all Class-C bundle planning. Then evidence-based practice Class-C insertion bundle. Insert the only if they are clinically indicated. Okay, insert only if clinically indicated. Then catheter with minimal number of the pots needed should be selected. Then hand hygiene before and after the procedure. Then comes to aseptic techniques. We are using the aseptic techniques because it is a invasive procedure and a full body sterile draft during the insertion. Then next comes to evidence-based practice. Class-3 insertion bundle, the scrub the hub. Then use the sterile gauze and transparent dressings and avoid the femoral sites in the adults. Okay, avoid the femoral sites in the adults. Only neck region we will use. Then evidence-based practice, that is Class-C maintenance bundle, hand hygiene and assessment of the CBP lines and sites documented in each site. Okay, then assess for the removal of the unnecessary lines. Assess the catheter site sterile device and cover the sterile central line lumen with the sterile and secure the catheter with transplant the dressing and replace the dressing that are wet, soiled or the dislodged and perform the dressing with a aseptic techniques and use the chlorohexidine. Okay, these are all the steps we will take as a classy maintenance bundle. Then Clepsy maintenance bundle flush the central line before and after the administration of injection. Okay, before and after we flush the central line catheter. Then after check the backflow. Backflow from the CBP before administration of or before collecting any sample. Then scrub the access pot or the hub with the 70% isopropyl alcohol or the 2% chlorohexidine before use. Change the IV line and a pressure monitor line as for the facility policy. Then next comes to next bundle, Corti bundle. Okay, Corti bundle. What is the full form of Corti bundle? Anyone from the group?
Catheter associated urinary tract infection.
Very good. Catheter associated urinary tract infection bundle. Okay. Okay. Cutty care bundle. Insertion and maintenance. Two things we will observe: insertion and maintenance. Then Cutty insertion care bundle, that is check the clinical indications for the catheterization. Then choose the catheter of appropriate size. Okay, it is also very important which person, male or female, or size of the catheter. Okay, then or children, the size of the catheter. Then next use of the sterile items, equipments. Then hand hygiene, wear a proper PP and follow the aseptic non-touch techniques. Use a closed drainage system. Okay, these are all the insertion process. Then after maintenance of the care bundle, Cotty maintenance care bundle, hand hygiene, then perform the catheter are aseptically, then urine bag should be follow the bladder label, then secure the catheter on the thigh without kinking. Okay, then review the necessity of the catheter regularly and maintain the unobstructed urine flow. Then maintain a closed drainage system at all times and empty the bag regularly. These are the cotton maintenance care bundle. Then next comes to SSI, surgical site infection bundle. SSI. Okay, SSI bundle surgical site infection. This is a picture of stitches, surgical site. The polyamides are stitches. Okay, surgical site infection. Then first is safety. Okay, safety is your operating room safe. Then are you screening for the risk factors and the presence of the Mars? Mars and mass. That is the different types of microorganism present in the operation theater. And so as the do you have your patients cleans their body the night beforehand morning of the surgical chlorohexidine. Okay, shower. Then skin preparation. Are you preparing the skin with alcohol based antiseptic such as CHG or the Lodo 4? Then solutions are you irrigating the tissues prior to the closure to remove the exogenous contaminants? Are you using CHG? Okay, switchers are you doing closing tissue with antimicrobial suture? Then skin closure. Are you sealing the incision or the covering it with a antimicrobial dressing to prevent the exogenous contamination? Then in all total, the sepsis and as well as the bundles of care in the ICU. This is all the topic. Okay. Summary. Why the human management? Okay, human management of the patients is the best safeguard against the infection. Florence Nightingale, according to. Thank you. Next topic देखना. अरे ସସ୍ମିତା ସେ ଟପିକ ଟା ସରିଗଲା ଆଉ ଗୋଟେ ସ୍ଲାଇଡ ଲଗେଇଦେଲ ମା ଦିଟା ଆଉ ଗୋଟେ ଅଛି ହବନି ଆଉ ଗୋଟେ ଅଛି ହଉନି ନାଇଁ ମାମାର ଅଛି ଏଇଟା ଛୋଟଟା ବଡ ବଡ ଯାଉଛି ଏଇଟା ବଡ ହେଲା ଏଇଟା ବଡ ହେଲା ନାଇଁ ଏଇଟା ବନ୍ଦ ଅଛି ଦେଖିଲା ଏଇଟା ବି ବଡ ସ୍ଲାଇଡ ବେସିକ୍ସ ଟାଇମ ହବନି स्ट्रेस मैनेजमेंट अच्छी काम तो एटा Hello. Hello, student. Hello. Hello. The slides visible? The stress management slide visible?
Yes, ma'am.
Yes, ma'am.
Uh-huh. Though this is a very a short slide, but the topic is highly essential for your topic. Critical care nursing ना the decision course के लिए stress management is also one of the important topic. Okay. What is stress? All you feel? In your workplace you feel stress, any type of problem. Okay, what is stress? बच्चों, what is stress? Hello. 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 तो बिरयानी এটা সরিয়ে ମୁଁ ପଳେଇ ଆସି ସରିଯିବ ଯେ
हेलो
ହଁ
हाँ
what
मैम
is stress कौन को
हेलो
हाँ hello
हाँ
the
मैम
slides are visible
हाँ मैम
हाँ stress कौन what is stress
स्ट्रेस एक मैम कोई चैलेंज पे ह्यूमन का रेस्पॉन्स चेंज हो जाता है स्ट्रेस
हम्म
फिजिकल भी हो सकता है मेंटल भी हो सकता है
हम्म
Ma'am, stress is any pressurized condition
very
which
good
are having
very
many types like physical, mental, social.
हाँ हाँ okay though those who are admitted in the ICU the ward ICU it is also a one of the stress for the family members no hmm?
Yes.
Hmm. Okay, now we will start the topic stress. Stress is a wear and a tear. Our mind and a bodies experience as well as we attempt to cope with our continuity, continually changing the environment. Okay. Then definition of stress according to Cellile 1956. Stress is defined as a pressure experienced by the person in response to life demand. Okay, demands. These demands are referred to as a stressors and include a range of the life events, physical factors like cold, hunger, hemorrhage, pain, environmental conditions, and personal thoughts. Physical, mental, all those things. Okay, that is known as a stress. Then, second, according to Selly 1976, stress is a process of adjusting to or dealing with circumstances that disturb or the threaten to disuse a person's physical or a psychological functioning. Then comes to next definition. Stress is a tension, strain, or the pressure from a situation that to requires us or to use, adapt, or develop new coping skills. That is stress. Then how to manage that situation, how to manage stress is a body's automatically response to any physical or the mental demand places on it. Adrenaline is a chemical naturally produced in our body as a response to stress. Then flight or a flight response is elicited. Then stress is that is definition of a stress. Mm, 1, 2, 3. Okay. Stress management. Stress management is the the ameliorations of the stress and especially chronic stress often for the purpose of the improving every day. And then functioning stress produces a numerous symptoms which vary according to the person's situation and severity. Okay, and these can include the physical health and decline as well as the depression. Then stop the stressing, start living. Okay. Then stress occurs when the pressure is greater than the resource. Okay. Pressure S is equal to P more than R. Pressure is greater than the resources. If our resources is less, pressure is high, then stress occurs. Then types of stress. First is distress. Okay, one is a distress. Types of stress. First is a distress. Stress due to an excess of adaptive demands placed upon us. The demands are so great that they lead to bodily and mentally damage, unexpected death of a loved one. That is the example of distress. Then second one is a eustress, the optimal amount of the stress which helps to promote the health and the growth. That is a example price from a superior for hard working. That is the eustress. Then is all stress bad? The moderate level of the stress may actually improve the performance and efficiency. If we will not stress any task, then it will be not complete within time period. So moderately level of the stress may actually improve the performance and efficiency. Too little stress may result in boredom, and too much stress may cause on productivity anxiety level. Then stress feelings, worry, tense, tired, frightened, and elevated, depressed, anxious, anger. These are the clinical features of stress feelings. Then next comes to stress. Okay, stress performance collection. Stress performance connection to mainly high. Okay, then low stress, sleep, alertness, then optimal, that may be the medium stress, the growth is high, and the client is very smoothly running. Then anxiety or disorientation in the high stress. So medium stress is good for everyone. Okay, performance. Then common signs of the stress. Then common signs are crowding heart rate, then shaking and inability to make the decisions, inability to act, inability to lack of focus, and hyperactivity, and appetite change, and sleep pattern. These are the common signs of the stress. Then potential stress, that is triggers. Okay, then these are the Many potential triggers of the stress, including the following: increase responsibility, major life changes, marriage, divorce, relationship, and troubles, children birth, childbirth, and the death of loved ones. These are the example of major life changes. Then next comes to relocation. And he has relocated, newly appointed, and a financial pressure, job changes, natural and man-made disaster, and many other factors. These are responsible triggers to the stress. Then stressor. Pressure is a stimuli preceding to precipitating a change. It may be internal, pure or guilty, or external trauma, pure pressure. These are the external stimuli or internal. Internal, that is pure guilty, and external trauma, pure pressure. Then identifying the stressor, situation, activity, relationship that cause the trauma to the one's physical, emotional, or a psychological self. Okay, then stressor mainly stressor, school, work, family, relationship, legal, financial, health, illness, environment, living situation. These are the all types of different types of stressor. Okay, different types of stressor. If the patient having a divorce or a deadlines, different type of pressure, challenges for pressure, or a work, hard work, appointed bills. These are the different types of stressor. Family, death, promotional problem. Okay, sick. Then these are all types of the stressor, like picture given to the you. Examination stressor, stress. Then comes to types of stressor. Physiological stressor, chemical agent, physical agent, like physical agent, illness, injuries, hormonal fluctuations, then inadequate sleep or the nutrition, then infectious agent, nutritional imbalance, genetic or a immune disorders. These are the physiological stressor. Then comes to psychological stressor. Accidents can cause stress or the victim. For the victim, the person who caused the accidents, and the families of both. Stress experience of the family members and friends, and a fear or aggression or the mutilation for the others, such as a murder, rape, terrorist attack. These are all fear and aggression or a multi lesson form stressor. And events that we see on the TV, such as a war, earthquake, violence. These are the events, and developmental and life events. Then rapid changes in our world, including economic and political structure and technology. Then negative effects of the stress: physical, weight gain or a loss, unexpected hair loss, heart palpitation, and high blood pressure. Then emotional mood swing, anxiety can lead to depression, and can also lead to unhealthy coping strategy, alcohol, drugs. These are all regarding the stress factor. Then comes to negative stress results. Mainly loss of motivation, negative pressure, negative stress results from the loss of motivation, reduce the effectiveness, and a physical, mental, and a behavioral problem. Okay, if the negative stress occur, then these are the problems arises. Then comes to learning to manage stress. How to manage stress? The learning point regarding stress. The mainly effective stress management involves the following: learning to recognize and a sign that you are experienced stress. First thing. Second is recognize the circumstance that trigger stress reaction in you and applying the stress management techniques to help you cope. Then recognize the signs of the stress. Stress in both psychological and a physiological response to change. It does not manifest itself the same way in everyone. Some people do not eat enough when they are stressed. Other eat very much, and some of the develop insomnia during the times of stress, then while others are sleep excessively. When your ordinary behavior and a response change significantly as a result of the life circumstance changes. are, are you experienced stress? The need of the stress management. Need, what are the need? How to manage this stress? Okay. Then first point is in the past decade, the news. Okay, the news headings are having a definitely made it and clear that the need for the stress management should be one of the top agenda in the modern day society. The ranges alone such as the road rage and the trends of violence acts in the life today prove a lot of it well. Then living today is a lot of torture. Then it was a given days the Great Depression. Then it is been coming out in many ways such as time occurrence of stomach and intestinal ulcer and other finding sleep disorder and a window. So many diseases arises insomnia and in growing handle leads of the boundary. And today's stress management is important everyone's life. It is necessary for a long and a happy life with a less trouble that will be come out. And there are many ways to deal with the stress ranging from the dealing with the causes of the stress and simply burning of it with effect. Importance of the stress management. The stress is something that everyone's experience, so learning how to cope with its effect is something that everyone need to manage master for their own physical and psychological well-being. Second point, those who do not learn and use appropriate stress techniques, then that can be variety of the negative effect, including physical illness, psychological illness, damage, personal relationship, and as well as a poor productivity and more. These are the total importance of the stress management factors. Then stress relief strategy, mainly body relaxation exercise, breathing technique, and a guided imagery. All you know that guided imagery. Then physical exercise, yoga, workouts, workout routine and a medication, properly use of the medication as needed to the people, and a counseling, talk therapy, life coaching, okay, stress management, that is relax relax techniques, um, meditation, deep breathing, visualization activity, aromatherapy, massage therapy, then exercise, aerobic activities, running, swimming, Zumba, anaerobic activity, walking, stress, stretching, yoga. Then next comes to nutrition. Nutrition, eat balanced diet. Then stay hydrated with a plenty of water. Avoid processed food. Reduce caffeine consumptions. Avoid alcohol. Take appropriate nutritional supplements. Then sufficient rest is highly essential to human body. Get plenty of the sleep. Then take a few short breaks throughout the day. Allow your mind to rest periodically. Then next comes to goal setting. Breaking major projects task down into the achievable goals. Set milestones for goal achievement and track progress towards the goal achievement. Then accomplishment and reward yourself for progress. Then next journaling. Keeping a journal is a good way to keep stressor from building up inside yourself. Journaling also provides a way to make it easier to recognize circumstance and a pattern that lead to stress reaction. Writing down stressors can be a great step towards the learning how to manage them effectively. Then proactive communication. It is also one of the stress management factor. Proactive communication. Express your feelings to those who are involving in your stressful circumstance in your life, and discuss the circumstance you are facing with the trusted friends and a confidant. Then seeking counseling or the therapy. Seeking counseling, stress, those who are feel so much stress, they are really seeking counseling, therapy or a therapy. Seeking professional assistance when needed is a sign of the strength. Working with a qualified therapist, counselor, or other qualified mental health professionals can be one of the best way to learn how to deal with stress. Then deal with the circumstance. Engaging in a avoidance of the behavior is not a effective technique for stress management. Ignoring problems or a protecting that things are fine when they are, and not only leads to greater stress in the long run. Managing stress effectively requires actually dealing with it and working throughout it. Then next point, applying effective time management skill. Take the time to get the organize and prioritize your to do list, then learn to delegate, then leave time for yourself in your schedule, and learn how to say no to stress in inducing results, inducing requests that are not essential. Then comes to last stress management that works for you. Finding the stress management techniques that work effectively for you in the stressful situation that arise throughout your life can be powerful resource for the health promotion, and be mindful of when you experience stress, how it affects you and what. Then action best way to cope with the effects. Then other helpful things, changing the perception and expectation, break jobs or tasks into manageable parts and set the reasonable and realistic goals and avoid procrastination and set boundaries and don't compromise your values and beliefs. Then benefits of the stress management, physical health gets better and more energy and stamina, emotional stability, positive attitude, hopeful and happier, ability to focus, improve, able to learn and achieve. Advantages of the stress management. Business advantages and stress management. Less absenteeism due to stress related disorder and less worker compensation loss due to stress related illness accident. Improve the job performance and a less stressful and a more effective work. Improve the employee's attitude and improve the employee's overall health. Okay, then advantages of the stress, that is health advantages of the stress management, decrease the stress related symptoms, improve the self and decrease the anxiety, decrease the use of the medication and reduce the pain, increase the ability to manage pain and increase ability to relax physiological and increase the sense of control and improve the self-esteem. Then advantages, the consumer advantages of the stress management, no side effect, non-pharmacological, non-surgical, no cost effective. These are all regarding the stress management and a relay our brain and fires electrical and 14 more seconds. Then after we familiar with these studies. Okay, these are all about the stress. The key word is balance. First think how do we balance self, then only the complements relaxation, guidance, medication, happy, stress-free life and a mindfulness up and a calm medication, sleeps. These are the medication for everyone. This is all about our topic, stress management. Okay, thank you. Hello. ସମସ୍ତେ ସୁଇଚ୍ ଅଫ୍ କରିଦେଇଥିବେ କାହିଁକି ନା 2 ଘଣ୍ଟା ପାଠରେ ଆଉ ତାଙ୍କ
ଆଜ୍ଞା ମ୍ୟାଡ଼ାମ
ହଁ
ଆଜ୍ଞା ମ୍ୟାମ୍
ଆଜିର ସରିଲା ଏତିକି ଆମେ କମ୍ପ୍ଲିଟ କରୁଛେ ସେକେଣ୍ଡ ନେକ୍ସଟ ଦେଖିବା ନେକ୍ସଟ କ୍ଲାସରେ ଆଉ ଓକେ
ଓକେ ମ୍ୟାମ୍
ହଉ ଥ୍ୟାଙ୍କ ୟୁ କେତେ ଜଣ ଅଛନ୍ତି ସ୍କ୍ରିନଶଟ ଗୋଟେ କାଢିଦବା
ଥ୍ୟାଙ୍କ ୟୁ ମ୍ୟାମ୍
ହଁ ୱେଲକମ୍
Thank you, ma'am.
ୱେଲକମ୍ 19 now close the session okay
Malhotra. I am